We're ready and go. Hello everybody, welcome back to part 2. As you can see from, get my little pointer. We're moving along the patient activity data policy and the patient activity data journey. We're now going to go into our colleagues in analytics and performance reporting and give you some presentations on what they do. Close in on that. First of all, we're going to hear from the National ABF program. And our presenter is Bing Rivera, who's the manager of the program. And she's going to explain to you a little bit about the role of this team in terms of how they are, go between the state and the federal, and how she liaison consultation that she undertakes with the national bodies. So over to you, Bing.
Thank you. Thanks, Kat. So I am a very small team of 3, including myself. We have Leonie as a consultant that comes once a fortnight. So what I'll do is I'd just like to highlight 3 of my team's key functions. And so the first one is basically that we coordinate WA's input into the development of national pricing and ABF policies. And you would have heard, or you may have come across the IPA pricing framework. It's the annual publication that they do, the national efficient cost, national efficient price determinations. And so whatever input WA has, we coordinate them going up the hierarchy. So the IPA, Independent Hospital Pricing Authority, is an independent government agency that's responsible for facilitating the national implementation of ABF, and they have been around since 2011. Another piece of work that we coordinate is the development of new classification systems. An example of this is the Australian non-admitted care classification, which some sites have participated in 3 years ago, but the costing study for this work has been suspended when COVID occurred. And IPA is now trying to look for some restarting processes or approaches in the very near future. The third piece of work that we are involved in and coordinate with is the implementation and refinement of existing classification systems. So you have up there on the board the AN SNAPs, which you probably have heard in previous presentations for subacute and non-acute, the AECC for emergency department, the Australian mental health care classification for mental health, Tier 2 clinics for non-admitted, and the Australian teaching and training classification. So there are a lot of work and stakeholder engagement that we have had and is continuing to have with you around input to these classification systems when they are being implemented and or refined. The second key function that the unit does is basically the education and training of clinicians for the implementation of the Australian mental health care classification. As you are aware, the AMAC is a mental health specific classification that has been implemented nationally and in WA for inpatient services this financial year. One very important variable in the AMAC that's been the focus of the statewide education and training is the mental health phase of care. So it is a clinician rated variable, and that's why the education and training session has been focused on clinicians primarily. We are planning to commence a refresher training in a couple of months, and we'll keep you posted in terms of scheduling. So you will hear from us then. Our team is also involved in advocacy and advisory role on ABF matters and issues. So what I mean by that is if there are queries around ABF and related issues, if we can resolve them locally or answer them from local information, we provide that answer straight away. Otherwise, we always liaise with the IPA to get their input into that. So why are the business rules on patient activity data important? I'll give you a couple of reasons. One, the business rules are fundamental in ensuring that patient care and treatment are accurately and consistently captured in data collections. The data is reported nationally to inform the development and refinement of policies and classification systems. Two, the data collected based on those business rules inform very important government decisions. For example, since the pandemic started in 2020, WA and the rest of the states and territories have been providing COVID-19 data nationally and locally, and they were used to inform decisions at the Commonwealth level and a state level on COVID-19 response. Another example is that the WA data is used to inform national and local initiatives. Now, we have been developing, we meaning WA, through the funding and commissioning model, and as well as nationally through IPA, some innovative funding models of care. And most of you may have heard as an example of the virtual emergency medicine program that is currently being in place at Fiona Stanley in South Metro. And so we are trying to understand a bit better the data that's being collected through that program to ensure that data collection is comprehensive. And again, it's a very innovative program that I think we can be very all proud of. If you require more information about IPA's work, we will provide you with basically there is an email there for our team if you would like to raise some issues or queries. Otherwise, we can also provide you with the link to the IPA website that contains a wealth of information around ABF classification systems and related topics. So that's basically a summary of what we do. Thanks, Kat.
Thanks, Bea. So you've been around for 11 years?
Not me, but
Not you. The team has been around
more or less in
for
and out.
11 years.
In and out.
Yeah. That was interesting to know about the team's role and perhaps some, a whole function that maybe some people don't know much about. It's certainly important that, we do advocate for Western Australia on the national scene. We may be small in volumes, but we're very large in the country, in the state that we have to operate in. We did have a couple of questions for you. One is, are there any issues that you discussed in the national arena that are very particularly relevant to, I guess, the uniqueness of WA? It's a real WA thing, and you have to speak up for WA, kind of, yeah?
Yeah, in 2017, it's the remoteness, basically. It's the remoteness nature of WA. So in 2017, WA actually championed the patient treatment remoteness. So that's a loading that is provided on top of the national efficient price if the patients were treated in remote and very remote locations of the state. So that was work that WA actually had initiated that it ended up as an adjustment or a loading to the national efficient price. So I think that's one influence that WA had on the NEP process.
So we do have some sort of what they call cost disabilities,
yeah,
in a sense, because we're big and we have to provide healthcare to a large area. Another question we have is that Australian mental health classification system something uniquely Australian, or do they have something like that in other countries?
Not that we are aware of. I think Australia is the only country in the world that has a mental health specific classification system, I should say, and so everyone is looking into Australia currently in terms of how that's being implemented.
So we might be leading the way there.
I think so.
Yeah. And can we send questions straight to IPA?
Well, there's nothing stopping you or anyone sending questions from IPA, but it would be best if you can channel it through to us, because sometimes IPA would flick it back to us because it might have a local flavor and it might be best to be answered firstly here in WA. And if we need some national context, then that's when the advocacy role that I mentioned earlier would come into play, and we will forward that to IPA.
So if we want to have, a couple of people have mentioned today having input into things regarding to IPA. How do we go about it if we want to, we want to have some input into that, the pricing framework and the classifications, and I guess what work we would like to see IPA getting involved in. How do people go about that approaching?
Yeah, IPA operates on they have a work program, and so the pricing framework for 23-24, so that's next year, We have started that process already, and we have consulted with health service providers, and everyone has provided input to that. In terms of classification systems, that will also be included in the work program. So if you have any input or you want to have some input in any of those processes, it's best to contact us to give you the time frame of when that might be taken into consideration, and as well as there is a cycle.
Yeah.
Classification systems don't get refined every year, so there is a cycle to it. But we can help you with timeframes and might be the next steps.
Can people like be on a mailing list for IPA things, find out what's going on?
I will find out, because currently IPA maintains a working group and committees, but they are exclusive. The mailing lists are exclusive to membership of those committees, but they have a stakeholder mailing list. But I'll find out whether whoever wants to be there may be accepted or not. We'll clear it with them first.
Well, that's excellent. I mean, thank you very much, Bing. I think it's interesting to go onto the IPA website. It's masses of information there about everything, and some very useful information. And I think maybe if you go on the website, maybe you can sign up to receive, news from IPA as well. Otherwise, please direct any queries to Bing, and she will advocate or liaise with them as appropriate.
So that's our email, generic email address. It's best to send it to there, because then the other team members can actually follow it up if I'm not able to do so straight away.
And we didn't have any particular questions, any extra questions. So thank you very much, Bing.
You're welcome.